Whether you have had a breast cancer diagnosis, have a genetic mutation putting you at high risk of getting breast cancer, have had or are facing a mastectomy due to either of these situations, you will want to listen to this podcast today. This is a story I have been very eager to share with you. I want to begin by reading a portion of an Instagram post on the DIEP Foundation Instagram page I wrote from January of this year, 2024. In life, you develop lifelong friendships. In life, when we surround ourselves with good people who become good friends, you rest your head on the pillow at night with a feeling of gratitude. Rest well tonight and each day of your recovery. I can't wait to share our story in good time. The time has come. I'm going to be naming some surgeons this morning in my introduction for a reason. I want the listeners to pay close attention. We cross paths with people for a reason, whether purposeful or by happenstance. When I was living in Arizona, I developed breast cancer for the second time. And as shocking as it was, I had an excellent breast surgeon named Dr. Michelle Lay. What happened during my recovery in the months after she performed my double mastectomy, skin-sparing, nipple-sparing double mastectomy, it was life-changing for me. 7 months after Dr. Lay performed my double mastectomy, I found my, what I call just right plastic surgeon to perform my DIEP flap breast reconstruction using my own tissue. And that was Dr. Minas Chrysopoulos of PRMA in San Antonio, Texas. So I traveled from Arizona to San Antonio to have my reconstruction. The combination of these two events, the second diagnosis, mastectomy, reconstructive surgery with two phenomenal surgeons, led me to open DIEP Foundation in 2016. So you're listening to part of our resources that we provide for our listeners. This is where our stories, myself, my guest, come together. Through Dr. Lay, my guest today, Margaret Tueller-Prophet, and I met. On a warm Arizona day, when I was living there, we recorded 2 videos before her prophylactic mastectomy with Dr. Lay. And I'm going to put links in the show notes to both of those videos. And now it seems we've come full circle. In October of 2023, while I was in San Antonio doing some advocacy work with PRMA, I received a message from Margaret inquiring about PRMA for DIEP flap. You can imagine my surprise. She had implant surgery when we both lived in Tucson. And I smiled. How did this happen when I was standing in the very facility she would eventually be coming to for her DIEP flap surgery? Transitioning from implants to autologous tissue reconstruction. So I want to welcome you, Margaret Tueller-Prophet, to the DIEP Foundation podcast and YouTube video. Margaret, we have something else in common. We're both educators. We have a professional background as educators. And so I think that holds even more weight in our discussion today, because you, not only in your professional life, you have also, I feel like you've transitioned to be such a powerful voice for the BRCA community and for the reconstructive community too. So I'm just so pleased that we can finally share our story today.
Thanks, Terry. That introduction made me both teary and my cheeks hurt from smiling so much. I'm really glad to be here with you and just glad to know you.
Yes, yes. I have a few in the corners of my eyes as well, Margaret.
Yeah.
It's it's kind of amazing how much our stories have collided. So I'm going to sit back
Mhm.
and I'm going to let you take over because I have some questions and but I just want your story to flow because you're probably going to answer all of my questions anyway. So let's get
Okay.
going.
Sure. Do you want me just to start with my kind of how I got here or
Yeah, I think you should. I think what we
yeah.
should begin with is really um, the time of your prophylactic mastectomy, just to take a
Mhm.
little step back in time. When you and I first
Yeah.
met, we're not sitting in my kitchen, which I wish we were here in Seattle,
Yes,
but
right. That was so nice.
yeah, it was. And I remember coming out to your home too. You have such a fun, robust family feeling at your home. And
Oh,
but I'm glad to be sitting in this space with you today, having this conversation. So let's just take a small step back in time and tell us
yeah.
the reason for your prophylactic mastectomy, and then we'll kind of take it from there.
Yeah, so I carry the BRCA2 gene, and I learned this when I was young. I think I was maybe 26 or so. I had two kids at the time, and learned it when my mom got a breast cancer diagnosis, and my grandmother passed away from breast cancer. And so when my mom got breast cancer, it was kind of time for us as her kids to get tested. I came back positive. My sister came back positive. But again, I was young and had young kids, and so I just opted to do screening for that time. And so for years and years, I did screening. I think I found out I had the BRCA gene status in 2010. Um, and my mastectomy, my prophylactic mastectomy, wasn't until 2018. So for at least 8 years, I was really happy with my decision to just get a mammogram or an MRA every 6 months. And my sister was kind of on a similar journey. She's a little bit older than me, also opted for screening. And then in 2017, she actually got a cancer diagnosis herself, despite being really vigilant with her screening. She had even had an MRI and then discovered it on 4 months later, which is a pretty fast growing cancer. And it just, I mean, it rocked our whole family, obviously, but me just personally, I thought I felt pretty good about my decision to do screening. And then all of a sudden, I did not feel good about that decision anymore. And so around the same time that my sister was getting her mastectomy because of cancer, I decided to get a prophylactic mastectomy. And some of my decision behind that was that I had young kids still at the time. My youngest
Mhm.
was 3 years old, and I really felt kind of a sense of urgency. I looked briefly into deep flap, but and thought, man, that's a really great option, but I still have little kids. I don't think I can deal with that recovery. And again, I just felt that sense of urgency, like I wanted this done fast because I was really affected by my sister's breast cancer diagnosis, and for that reason, I kind of opted for implant-based reconstruction.
Was it the abdominal scar? What specifically about, because such a personal choice. Such a personal
Yeah.
choice what kind of reconstruction we have. What was it, would you say was the most defining factor for you not having autologous at the time? And what were the benefits of choosing implants at the time?
Yeah, so for sure the abdominal scar was scary. The
Mhm.
recovery just seemed so much longer and harder. And maybe some of it was influenced by the fact that my mom had implant-based reconstruction. My sister was going for implant-based reconstruction, and so that felt kind of familiar. And I just at the time when I did a little bit of research, I didn't feel like there was a great doctor I didn't click with a doctor in Arizona either at the time that I felt pretty confident with. I knew that this was something you probably would have to travel for. And again, also didn't feel really equipped to do that at the time. So knowing that I wanted to stay close to home, and that it just felt like the fastest, easiest, simplest thing to do is kind of why I went for it, I think.
Yeah, that all makes sense. Those are all considerations women have to take into account. And those are those lifestyle evaluations that we have to make. And all of that's
Yeah.
part of the conversation. We talk about having a shared decision-making conversation, and I so encourage
Hmm.
women to evaluate those lifestyle, um, you know, things that are so important to you, your family, traveling, the cost,
Yeah.
recovery time, all of the above. All right. So,
Yeah.
um, let me ask you this before we move on to your next decision to
Mhm.
have deep flap. What were the benefits and what were the maybe the most challenging parts of having implants? Because for no matter what kind of surgery we have, Margaret, we have to make adaptations.
Yes, for sure. You can't have it all. No.
No.
Benefits of implant-based reconstruction. Again, it was kind of, I wouldn't say a one and done, but it felt like almost like a one and done. I did have a second surgery because I had expanders placed. And so um and to be honest, like at the time, I liked the look of implants, right? Like there's a very full look from it. It's hard because I'm on the other side, and so it's hard to think of what the benefits were.
I knew that was going to be a
But
challenging question.
yeah, no, that's certainly a challenging question. But yeah. Well, sorry. Remind me what the second half of the question was. It's hard to come up with what the good things were because I there were so many that I didn't like about implants, to be honest.
Yeah, well, no. We don't need to do the second part because it's you're kind of going to answer it here when we segue into talking about why you decided to do deep flap then. You told me, but I think it's important for the listeners to hear.
Yeah. You know, I think the kind of interesting thing about me is I had a really, really good experience with my implants.
Hmm.
Nothing went wrong. And I had a really good recovery, like textbook, right? And so,
Hmm.
and I still didn't love them. And they were still challenging for me. They just felt, I think the number one thing is they felt like such foreign parts of my body, completely foreign, large, un, uncomfortable. But really, the number one thing is they just did not feel like they were a part of me.
Hmm.
Um, and it's like my mind could never get away from that. Every little movement or adjustment, like, oh, there they are, there they are, there they are. And then maybe secondary to that, I lost some weight in between my prophylactic mastectomy and now ish. And so my implants at the time fit my body, and I was already large chested to begin with. And so I had a very, very large implant size. I think the largest they make, I had silicone, I think I had Natrel implants, and I think the largest they make are 800 cc's, and mine were, I think, 770. Really, really large implants. And at the time they fit my body because I was bigger
Hmm.
and I was always kind of heavy chested. But I think I lost around 80, 90 pounds in between, and then they felt really big. And so
Oh, okay.
um and and so my body just like did not feel like itself, and I was anxious to get them out. Or at least like just have something more natural feeling for sure.
Yeah, that's a significant weight loss, whether you've had implants or deep. And I will
Yeah.
tell the listeners because, it's hard to tell this. It's always different when you see people in person. I've seen Margaret in person. You're a very tall person too.
Yes, yeah. I'm
So
5'9",
I'm,
and I
hmm
hold a lot of weight on me. So I know 80 and 90 pounds sounds like a lot. And it was, to be honest, it was, but also it was enough of a change in my body that my implants certainly felt even more foreign to the kind of
hmm
body that I had now.
mm. See, I wasn't aware of this
Yeah.
big change. This is all making sense to
Yeah,
me
I
now,
think I forgot
especially
to mention that to you. It
no.
was kind of a contributing factor that suddenly, and to be honest, like I recognize my weight is always going to fluctuate. I may gain back 80 or 90 pounds. I don't know. Like I hope I don't, but and so I didn't want to solely base it on the decision, but I lost that weight and maintained it long enough that I was like, okay, I think my body is around, this is sort of my new body, and my breasts certainly
Mhm.
don't fit that anymore.
Yeah.
And so it felt like, okay, maybe time to make a permanent change.
I'm really glad that you shared that specific personal information because there are so many women who talk about weight fluctuations, what's going to happen. So beautiful, beautiful explanation. I'm glad you wove that into our conversation today. Um, Okay, so my next question for you is, since you reached out to me in October of 2023, you and I had been in conversation throughout this whole time because, we're friends. I wanted to check up on you to
Hmm.
see how you were doing emotionally and physically. What was that like preparing for that? Preparing for your D flap, because you told me in October. I have no idea how long you'd been thinking about this. I found out about it in
Yeah.
October of 2023, and then you had your reconstruction in January of 2024 this year.
Hmm.
What was that time like emotionally and physically getting ready for this?
Good question. I actually had been thinking about it even longer than I had reached out to you. For several years, I wanted to do this, but never felt like it was time to pull the trigger. I'm trying to trace back why I decided to pull the trigger, and pull the trigger is probably too strong of a word. I kind of just passively started looking into it. I was like, huh, maybe I'll just fill out a referral form on PRMA. They probably won't get back to me. And I filled out a referral form for another doctor here in Arizona. And again, wasn't like I really was quite passive about it, but PRMA got back to me right away. And I was like, oh, great. Well, now I have to, now I'll get them this information. And I thought, well, I'll just kind of get it going. And it's like this train started and I couldn't get off. I mean, of course I could get off. And I did to some degree because I think that all happened in maybe spring of last year is when I started thinking about it and put
Ah,
in an inquiry. And then I want to say they came back to me and maybe even had a date for sometime in the fall. And it was
mm,
actually with Dr. Steve.
hmm.
And at the time, my oldest is a senior, and I felt super overwhelmed just helping him with the college application process. Like we were knee deep in like all of these college applications and all of these personal essays, and it just felt like a lot. And I was like, no, forget it. I do not want to have surgery right now. So I delayed it.
And you had time to
And
to make that priority.
Yeah, for sure. Like,
Yeah.
I am really blessed that I don't have like a cancer diagnosis breathing down my neck, right?
Mhm.
I have a lot of choice when it comes to when I could do this. So, but yeah, it's like I started the process with PRMA and it just went. And I never even looked again at the other surgeon here in Arizona, despite it being closer to home, just because they never actually followed up with me. I think maybe I got one phone call from them and I happened to miss the phone call and I never called them back and they never called me back, but PRMA was super responsive. And so I was like, well, I guess that's where we're going. And so
It's
that's kind
kind
of how I arrived at the point of
Yeah.
deciding to have surgery.
It's a bit like those emails you send someone where, okay, I'm going to email them and make this commitment. So like, and then once you get the email back, it's like, okay, I'm committed now. I'm committed. So
Yep.
you got the response
Yeah,
from them, and like you said, the
exactly.
ball
Yeah. Like
got
I've
rolling.
had several Exactly. I've had a lot of family and friends like ask, well, why now? And I don't have a great answer for that just because um, I started the process and then it came and I'm set up in a good place in my life right now. We've got good insurance. My kids are older. They are a lot more self-sufficient. My husband works from home and so was able to it just felt like, you know what, it sounds like it might be a good time to do it now. And my husband
Hmm.
just kept reminding me like, you have been wanting to do this for a really long time, why not now? And you're always going to find a reason to put it off. Just get it done. And so he really was kind of my biggest like push to get it done because I wanted to back out like a million times, and he was like, just get it done.
I'm going to bring your husband up at the end of this podcast for a few giggles,
Yeah.
but you know what I'm going to talk about probably.
Yes.
All right. So again, I know
Mhm.
Margaret. I know about her family situation and everything. Margaret, that varies from person to person, but tell us
Right.
about your support system. You're so
Yeah. So
fortunate.
I've got I really am so fortunate. I have an amazing husband who is super supportive. I've got four great kids who, despite having busy schedules, are also quite sufficient. And I live also in a really great neighborhood and community, and we've lived here long enough that we have um, just like a village that stepped in. And so, if my kid needed to get somewhere during the weeks that I was recovering, I didn't even think twice about it. Somebody was going to help drive them. And also my oldest drives too. And so that was helpful. But yeah, I really am fortunate in there was a ton of support, both just in my own house, but in my
Hmm.
kind of village at large too.
Yeah. And that's so important.
Mhm.
I know my second diagnosis, my boys were both adults and they made
Yeah.
sacrifices. They made sacrifices because our oldest at the time was still at the University of Arizona. Go Wildcats.
Yeah.
You
Yeah.
know,
Bear down.
bear down. So, okay, I'm going to bring up the funny story about your husband. You flew initially, you flew to San Antonio because I have just, I've been keeping track of you. Um, for a good reason. I needed to,
Nice.
because you're just a good friend. But you flew to San Antonio by yourself initially, and
Hmm.
then your husband flew in because I remember you said, "Oh, I'm going out to the airport." We were texting each other. I'm gonna go
Yeah.
pick him up now. Okay, I'm gonna tell the funny story. Can I tell the funny story about his shirt?
Yes, please do.
He had this, my favorite color, I think it was blue, maybe it was blue green. He had this shirt on with little, okay, I'm just going to call them boobs, all over them. And I'm like, who does that? That's a cool husbandator right there. That was really, it was so funny to see him because, to me, Margaret, what that showed me as your caregiver is that he was there for you, but he was going to blend it with a sense of humor. And oh my gosh, in this breast cancer and breast reconstruction space, if we don't have a sense of humor, at some point, I just don't know how people are going to get through it. So, shout out to hubby for his cool shirt. Um,
For sure. It was
yes.
totally, it was definitely a boob shirt, not a breast shirt. It was a very silly shirt and it got so many comments and laughs and funny stares at the airport. Dr. Whipple loved it. Like that shirt has gotten its mileage out of it and definitely made us all laugh quite a lot.
Okay, so you had Dr. Whipple as your primary surgeon and Dr. C, which is another amazing story. You had Dr. C, who I had for my reconstruction, as her co-surgeon. What did he say about the shirt? He's got a little bit of a sense of humor himself. Did he see the famous
I'm trying to
shirt?
remember. I don't know that he saw it. I think that morning of surgery, my husband wore a normal shirt, unfortunately. So I don't know that he saw it. Dr. Whipple loved it, but if I go back and Clark is with me, Clark's my husband, then I might have to, he'll definitely have to bring the shirt and hopefully we'll run into Dr. C. I don't know.
I think you should. I want to know what his reaction is because the man's sense of humor, it never surprises me, his reactions.
Oh, I bet.
There's things bottled up inside of him that just come out at the most unexpected times. And I'm like, is that British? Is that just you? Or where did that come from?
So
Yeah,
funny.
tell Clark to wear that shirt for phase two.
I will.
Okay, so what did you do? What did you do before your surgery when you were by yourself in San Antonio?
Oh, I love this question because like I'm a mom of four. I don't ever get to be alone, and
And you're a
I
bit
had
of a
fun.
historian. You like
Yeah. Oh,
history and culture.
I do. Like, I love being a tourist. Like, put me in a
Yeah.
brand new city, which San Antonio was to me, and I wanted to see all of the things. So, of course, I saw the Alamo and I took a riverboat tour, just walked around that downtown area, which was really fun. And oddly enough, it rained most of the time that I was in San Antonio. It was very misty and rainy, and everyone kept telling me it's not normally like that, but I loved it. I had my umbrella and I just whatever I felt like doing, I did. And so played the tourist. I had really delicious barbecue. It was fun being a tourist in San Antonio. And then there were a couple of other things that were less touristy that I did. I think I had maybe 2 days to myself as I waited for my pre-op appointment. I really pampered myself. Like I went and one, I was just kind of bored and didn't know how to fill the time. So I got like a lash lift because I was like, I'm not going to be wearing makeup for a long time. Maybe I'll get make your eyelashes a little longer. And then I went to a dry bar where they shampoo. All they do, they don't cut hair, they just shampoo and blow dry your hair and they open up a menu of hairstyles. I think I did that the night before my surgery, knowing that, I'm not going to be washing my hair for a few days and it'd be nice to have really nice blown out hair. And so there were just a couple of pampering things that I did, knowing that like the next, 4 to 6 weeks were going to be really rough on my body. I wanted to just, pamper myself a little bit before that, and I'm really glad I did.
Your control over a really challenging situation. I love it, which explains a lot about why you look so lovely the morning of surgery. Uh, so at least for the podcast cover is going to have that famous picture. I want to know about that morning, the morning of surgery when full disclosure, the foundation sometimes has care packages that we send. Not always. We're not in that business, but occasionally we will send out care packages to patients. So when that delivery was made, and you will see it on the podcast cover when this is produced, but tell us about the morning of surgery and how you were feeling. Like you said, your primary surgeon was Dr. Whipple, and just the trust that you were feeling in her and the confidence and everything. What was that morning like?
Yeah, surprisingly, I was remarkably calm that morning, which is
Mm.
very unlike me. I think I knew that I knew that I was in the best hands and that this was the right decision, and I just felt like everything was going to go really well, which is so unusual for someone like me who really likes to catastrophize things, but I just felt an odd sense of calmness, and I remember even just walking in to the landmark. Is that what it's referred to as, the landmark?
Yes, it is a Methodist healthcare system hospital. It's a boutique hospital that PRMA opened
Right.
in the fall of 2023, and it's called Methodist Landmark.
Okay, so when I walked into Methodist Landmark, first time walking in, I mean, just so impressed. And the check-in process was smooth and impressive. And I don't know, it's just these little details that really put my mind at ease. Like
Mm.
everyone was so kind and professional, and the facility itself was beautiful that it just, yeah, like I said, it just put my mind at ease. And everything went just kind of as expected. I got to meet, it wasn't my first time meeting Dr. Whipple, but first met with Dr. Whipple. Dr. C came in. I got to meet the anesthesiologist, and everyone themselves had such a calm presence about them. And I think that was super calming to me. Just like, I don't want to say casual, but just like, you know that they do this so often, and that they know exactly what they're doing, right? And so even though everything felt kind of new and foreign to me, I was super put at ease knowing that I was in really, really good hands. And so, you're in a tiny little room getting all the paperwork signed and changing. And my husband helped me change into, the compression garments and the different gowns. I think I had a bear hugger gown on me.
Yeah,
And
keeping your blood
I at
vessels
some point
warm.
yes, exactly, to keep you
Mhm.
warm. I guess before changing, Dr. Whipple marked me up, and we kind of just went over what she was going to do. And then they made sure we had to get our picture. And I was so thrilled to get that care package. And I remember thinking, like, don't let that get lost. Like, I know my belongings are going over there and this, but like, that's the one thing I don't want to get lost. I didn't open it quite then. I knew that was something I could look forward to after surgery, but it felt nice knowing there were people back at home and in other places that were thinking of me and supporting me, and it was such a nice touch. So I super appreciate that.
Oh,
And the
you know,
blanket in it is like my favorite blanket now. My kids fight over it. I'm like, that is my surgery blanket. Lay off. So we all fight over our deep sea blanket.
yeah, it is kind of cozy. I
Yeah.
have one over my lap right now. It's a little chilly outside.
Oh,
Um,
perfect.
yeah, that's really cool. I felt like I needed to buy a ticket that morning and just be with you, Margaret, because I
Oh,
knew the exact date of your surgery and everything. So, but I knew you were in such good hands. So
I
did
felt your presence.
did your husband stay at, you know what I'm going to do? I thought of this. I wrote a little
Mhm.
note while we were chatting. I'll put in the show notes also that video that I did with Dr. C when I was there in October, because he did a
Yeah.
tour. So I'll put that in the show
Uh-huh.
notes too, so that people can get an idea. I mean, I think that when patients go to facilities, no matter where they go for their surgery, they always want to know, where am I going to be staying? What's the facility like? I
Mhm.
remember well, my facility at University of Arizona, when I had my mastectomy, all of those things just kind of stay in your mind, but you want to know that ahead of time. So I'll put in the
Yeah.
show notes that video that I did with Dr. C so that they can see, you know, the great facility that you were just talking about. So did Clark, your husband, stay with you? Because I know now they have
Mhm.
rooms that have an attached room for family members or caregivers.
Yeah. So this is kind of a funny story. So they rolled me back to surgery, and he didn't stay during surgery. They said, "Hey, this is a long surgery. We will call and check in with you," and they did. So he went back to our Airbnb, which is about 10 minutes away, and he works remotely. So went back to work and got lots of great updates. And then I think at one point they brought him back to the hospital while I was still in the recovery, and brought him back to the room that we initially thought we were going to be staying at. And it was one of those beautiful rooms that had a guest suite. And he was like taking video and sending it to everyone, like, look at our room. Somewhere in the process between that and the room that I eventually ended up in, I think they realized. So I didn't end up in the beautiful, huge room. I ended up in just a beautiful, normal room, right? Without the extra guest suite. And I think the reason behind that was that the floor that had the beautiful guest suite only had male nurses at that time or something, and they felt like I would be more comfortable with a female nurse, which, fine with me. My husband probably would have appreciated the guest bedroom, but I was much happier to have a female nurse, because they're coming in very frequently and opening up your bra after recovery and checking you every hour. And female
Mhm.
nurses, they helped me shower. So, I was glad for that decision, I guess. Bummer about the guest bedroom, the extra guest suite, but even just the normal rooms are beautiful. So
Oh, I know.
so
They're
my husband Clark
huge.
didn't end up, they're huge, enormous. Even just the normal room is
Mhm.
beautiful and enormous.
Mhm.
And I was comfortable enough in it that he actually didn't stay overnight. He could have. I think there was a pullout, but again, our Airbnb was close enough that he went home for the 2 nights that I spent in the hospital. And I was pretty sleepy anyway, and I was totally fine with that decision. He'd leave in the evening, come back in the morning, and it worked out just fine.
You know what? That's exactly what we did, but I planned it
Yeah.
that way. I remember the
Did you?
anesthesia, or I think it was the nurse. It wasn't the anesthesiologist, although I love my anesthesiologist. Um, the nurse said, because see, I had mine December 1st. I remember her saying, you need to leave the hospital today, go shopping, do whatever, because it was around the holiday
Yeah.
season. And I'm so glad my husband does not like hospitals. Funny story
Yeah.
for the listeners. When he was a child, he broke his arm. I think it was ice skating. It was like on a Friday. He didn't tell his parents till Sunday because he didn't want to go to the hospital.
Oh no. He
I
had the
might be
strong
embellishing
dislike
this
for
story, but I remember this and I just knew how much he didn't like the hospital setting. So I did the
Yeah.
same thing, Margaret. He works, he was able to work remotely. He brought his laptop. Our Airbnb was close. We were at the big Methodist hospital because this is before they opened up Landmark. Um,
Mhm.
and I think this is all important information for listeners to know because there are some husbands or caregivers, partners who want to physically be there. There are
Yeah.
others, like it sounds like Clark and my
Yeah.
husband. I really felt like mentally he needed to be away from the hospital for certain
hmm
periods of time. He loved coming up. I remember him bringing me a Chick-fil-A peppermint malt when I finally got back on solid food because they weren't doing
Oh.
ARS. They just started ARS, shortly after that. But all of those little details, I think, patients want to know about sometimes. You've got to know your caregivers too. We've got to take care of caregivers.
hmm
I think it's so
Yeah,
important. And so,
for sure.
yeah, I'm glad you shared that about Clark, the fancy shirt man. So
Yeah.
that's good. Um, all right, let's go to recovery. Did you tell us about your recovery, how it went? Did you allow yourself to have those moments of tears, frustration, moments of joy when you saw progress? Tell us a little bit about that.
Oh, for sure. Let me start with the joy. Yeah, for sure. I remember at one point, so I stayed two days in the landmark and then went back to an Airbnb. And my husband and it was just me and my husband. It was super nice. And I picked my Airbnb based on two things: location and recliners. And so my Airbnb had a large sofa that had two recliners on each side. And um, other than that, it wasn't the super nicest Airbnb. It wasn't terrible, but I was like, I just need those recliners, and a close location would be nice too. I lived in those recliners, and I remember at one point, and my husband had to help me with just about everything at first, even something as simple as reclining out the footrest and pushing me back. I couldn't do any of that. But I remember at one point saying, "Hey, look at this trick." And I was so excited because I could lift up my legs myself. And that was within the first days. And so it's an incredible how little your body can do at first, but then how quickly it makes progress. And I quickly started to notice like, oh, I can do more. I can reach, he doesn't have to hand me all of my medications. I can reach it more. But he certainly did just about everything at first. Particularly when it came to showering and dressing, I needed a lot of help with that.
Mhm.
And there were a lot of tears. Like there were a lot of just frustration when I realized, like, duh, my body is not going to be the same as it was, and I'm not going to be able to do the things that I love to do. My surgery was on January 25th. And I'm a big hiker and love hiking. And the best month to go hiking in Southern Arizona is February. It's my favorite
Yeah, it
month. The weather
is.
is just perfect and
Yeah. It
beautiful.
is.
And I didn't think of this, but I remember we flew from San Antonio to Phoenix because there wasn't a direct flight to Tucson, and had to drive home from Phoenix. And I just remember looking out the window, thinking of all the trails I was going to be missing out on, and just sobbing, like over hiking. Like, what a silly thing. I realized this is a short period of time, but I was really sad that this thing that I love, I can't do for a really long time. And a lot of moments crying over just the inability to care for my kids and my house, and of course, like, my husband was totally taking over these responsibilities so well, but it was frustrating that I can't do the things that I normally do.
We have to
But
lower
again, like,
we have to lower our expectations, don't we, when it
yeah,
comes to homemaker our homemaker role. I did. I'm
yep,
like, don't look at the dust
yeah,
bunnies. Don't look
just
at the
just let the
don't
house
look at
be
this.
a mess for 6 weeks. It's totally fine, and try not to be bothered by it. It's going to be okay. Your kids are going to be fine. They're going to be fed and clothed and whatnot, and things are going to be a little messy, and that's okay.
That's wow. I'm going back in time. I remember that feeling so well.
Yes, yeah. It's a hard feeling, but also it passes fast. And it felt like it was going to be like that forever, but you start to just see progress really quickly, and you're like, wow, I'm doing this thing that I could not do a week ago. I'm so amazed. And then before you know it, you're like, that was a short period of time when I felt like everything was the worst. It gets better.
Yet you cannot see that the day of. And then a week
Yeah.
passes and you look back and you go, wow. I hear that a
Yeah.
lot on our Facebook page, Margaret.
I'm
It's like,
sure. Yeah.
hang in there, ladies. It's going but then
Yeah.
you hear the stories of women who are in recovery the first few days and you're just like, you just want to tell them it's going to get better. It's going to be okay.
Yeah.
So,
Yeah. For
um,
sure.
I want you to tell us another story real quick. You came home with drains. I was That's varies. So I'm not going to say I was lucky. I mean, I felt like I
Yeah.
was. I didn't have drains when I came
Yeah.
home. Tell us a little bit about that because that's a big question I get asked often. So share your experience.
Yeah. And definitely a question that I had. I initially had four drains, and I was really lucky that at my post-op appointment, I could remove the upper drains that were attached to my breasts, but I wasn't ready to remove the abdominal drains. I flew home a week. I think it was a week almost to the. I think it was a week to the day that I had surgery. Which now that I think about it, sounds crazy, but it also felt doable, and I was excited to get home. And before I left, I had a good friend who said, you need to get a wheelchair. You have to get a wheelchair. And I was like, that seems a little extreme. She's like, nope, I'm going to insist on this. If you don't call Southwest and make the arrangement, I'm going to do it for you. Like, she really wanted me to get a wheelchair. So I was like, all right, I guess I'll do it. Best decision I made, or she made for me. I mean,
Mhm.
I don't think I could have done it without that wheelchair. And
It's exhausting.
so
I don't
I guess,
care how big or
yeah,
small the airport is, because
yeah.
to me, I mean, I live in Seattle. SeaTac is huge, but I can't
Mhm.
imagine going through SeaTac doing this. But I mean, I can now,
Yeah,
knowing what you can plan for. San Antonio is not a huge airport, nor is Tucson
right.
International.
Yeah,
But
right.
even having that wheelchair for those two is huge.
Yeah,
I did, and I flew
for
Southwest
sure.
also, so.
Yeah, so glad I got the wheelchair. I mean, because up until that point, all I had been doing was walking from the recliner to the bathroom, from the recliner to the shower, short little walks. And I was trying to walk as much as I could, and even that was exhausting. To suddenly have like a day where you're walking from the parking lot to inside and you're checking in. So glad we had the wheelchair, and it made getting through security a breeze. And
Yes.
I guess every airport is going to be different, but in the San Antonio airport, they whisked me right through security. I remember feeling kind of worried about, um, I'm trying to think if I had my drains in a fanny pack. I think I probably ended up pinning them to my abdominal binder that day because
Uh-huh.
I didn't want to have to argue about a fanny pack and going through security.
Yeah.
But I don't even think it was an issue. If I'm remembering right, I think they just bypass a lot of it because you're in a wheelchair. And it was helpful too for my husband because he had two carry-on bags and he had two suitcases he was rolling. He had a lot of luggage just to get through. So to have a Southwest employee kind of help push me through until we got rid of the bags was nice too. And then he was able to take over. So yeah, I 100% recommend getting a wheelchair if you're having to travel
Hmm.
back. But other than that, like it was doable. I had a rather short flight. Others might have longer ones. And even beyond the flight, we landed in Phoenix and I still had an hour and a half drive home. And that was okay too. Like,
Hmm.
you just kind of gingerly get in the car and have whatever pillows or whatever it is you need. And that was, not ideal, but totally doable.
That's when you had your little emotional meltdown.
Yep. Yep.
Do you
Watching
know?
all the beautiful weather pass me by, realizing that
Yeah.
I wasn't going to get to enjoy any of it. Yeah.
You know what? That's so funny. I'm thinking back now because my last leg, I did by myself because it was only an hour. I flew into San Diego on Southwest. For some reason, that was my leg. I flew from
Mm-hmm.
San Diego to Tucson by myself because my husband had to go back to work, and my friend came in and took over, and she flew from San Antonio to San Diego with me. And it was kind of a hectic time. Well, okay, it was the holidays, that's why. Um,
Mm-hmm.
Airport was kind of busy. I remember the lady that took us off of the airplane, because you get priority seating if you have
Yeah,
a wheelchair, which, we should note that. And
exactly. Yeah.
um, she took us off and she says, I'm going to take you the back way.
Oh,
I can't believe, because she wanted to get me to the next flight. And
yeah.
it was like kind of an ordeal, but I had to tell my friend goodbye. And all of a
Mm.
sudden, I was by myself for an hour until I got home and the boys picked me
Oh,
up, my husband. That's when I had my meltdown. And I'm
yeah.
so glad it was an evening flight, because I put my head down in the plane and the tears just, I mean, I'm like, I hope nobody's looking at me right now. But
Right.
you have to embrace those moments. They're a bit
Yeah.
cathartic, I say. And so our stories are so similar, Margaret. So interesting.
Oh.
Um, Funny family moments.
The shirt will probably stand out. And then just like, um, I've got three boys too. And so, there were some snickers and giggles. We started talking about breasts a lot more. And everyone was really concerned anytime I had to sneeze. Like the whole house stopped if it looked like I was gonna sneeze, and everyone, all eyes on me, like, Mom, don't do it. Like, be careful, because sneezing is really rough anytime you've had abdominal surgery, right? And so my sneezes changed a lot because I had to somehow swallow them, and my kids thought that was pretty funny. So yeah, I don't know. You find the humor where you can, but
Definitely.
yeah.
Definitely. Margaret, I'm going to go back as we wrap up here. I'm going to go back to your comment about flying home
Hmm.
a week after you had your deep flap. Now, again, I go back, mine was 10 years ago. It'll be 10 years this December, which I can't believe, just shortly before they started using AirAS protocol. So I was in the hospital a little bit longer than you are and stayed longer.
Hmm.
I mean, how are you feeling now? I've watched your progress. We're going to tag your Instagram account so people can
Oh,
see some of your pictures, but how are
yeah.
you feeling now? I mean, you posted something on Facebook the other day on our group about you out walking the dogs. Just tell us,
Yeah.
how many weeks out are you right now at this interview?
Um, in 2 days I will be 6 weeks out exactly. So I'm 6 weeks out, and I'm feeling really, really good. Dr. Whipple told me no exercise before 6 weeks, but I felt good enough to go and do a very gentle stretching class at hot yoga about a week ago. And that was a little difficult. Like, I took it really easy, but it just felt good to move my body, to move it in ways that I hadn't in a while. But I'm feeling really, really, really good. I don't think I mentioned this to you before, but I think I think I had a partially collapsed lung. And I mentioned this to Dr. Whipple, and she's like, it's more or less normal when you've had a lung surgery like that. And it showed up about a week after. If I didn't have that, I feel like this would have been a much easier surgery, but I was really uncomfortable. It felt almost like a broken rib. I couldn't take deep breaths. And more than anything, I couldn't sleep long periods. Like, every 2 hours I was waking up because of this pain. And so I just was super sleep deprived. But I want to say about 10 days ago, that I guess just magically resolved, or just, my body it had reached a point of healing where it wasn't an issue anymore. And once that happened, I was like feeling on top of the world. I am still sore, don't get me wrong. My incisions are healing up really well. There's still a little bit of soreness and some tenderness. So I don't feel 100% the same as I did before, but recovery wise, I've had a really good recovery. And if it hadn't been for kind of that lung issue, it would have been even better. But, I think everyone's going to have different issues, different complications, but more or less, like, I've had a pretty straightforward, um, I wouldn't say easy recovery, but normal recovery, I guess.
I like that. Easy,
Yeah.
no, normal, yes.
Yeah.
I like
Yeah.
that clear transparency. Um,
Yeah.
what sage advice do you have, Margaret, for women who are thinking of transitioning because it's for a number of reasons? Again, personal preference.
Mhm.
What advice do you have for women who are transitioning from implant to autologous reconstruction? And I just thought of another podcast I will link in the show notes. I think, yes, I did a podcast with Dr. Paisano, who is also at PRMA. We did I think it was a podcast on transitioning from, implants to autologous. What sage advice would you have for women? I know
Oh,
that's a really wide open
I
question.
know that's a hard question. I think one, I would trust the process. Like, in the moment you feel like this can't be right, or I'm never gonna feel normal again, and you will. It just takes time. So be patient, patient with yourself and patient with your body, and maybe just trust your gut, I guess. Like, I remember having moments thinking, like, why am I doing this? Like, I have a perfectly great reconstruction, other than the fact that I kind of hate it and uncomfortable, right? Is that enough of a reason to go through this really difficult process? Like, I really waffled back and forth thinking, what if it's worse afterwards? And I mean, I can't speak for everyone, but for me, um, as hard as it's been, I'm really glad I made the decision. I'm really glad it is a short period of time where where it's really, really hard. But what I was dealing with before that was kind of like, a little bit of hard every day I had my implants for 6 years and was kind of uncomfortable every single day. And that was hard too. And this is like a short burst of a super hard period in your life where you are recovering and your body feels foreign and uncomfortable. But already I'm really happy with the decision that I made because I know long term I'm going to be so much happier with the breast that I have outside of the implants, and having that more natural feeling and just feeling like it's a part of me and not feeling like such a foreign um, thing on my chest. And so
Mhm.
I know that's not very succinct, excuse me, succinct, but
I
I
know
guess
it
just trust the
is.
process and trust yourself.
Yes,
Yeah.
I just wrote that down. Trust the process. That's a huge statement,
Yeah.
Margaret, because it is not an easy process for any of us. I
No.
cannot tell you, I'm just so grateful that we had this conversation today. I mean, so much of it just resonates with me, but also to see you, to see how well you're doing. Um, and let's just keep this on the radar. You've
Yep.
got you've got
I
phase two coming up. Maybe we'll do a follow-up.
I do.
We'll
I
think,
would love that. My goal this week is to make a decision about when to schedule it.
okay,
they've reached out to me and I need to reach back and I'm just trying to figure out what the timing is. It will be sometime this year for sure. So I would
yeah,
love to do a follow-up
yeah.
because
Well,
I'm actually really excited about phase two. I mean, things look good now, but
mhm.
I know that they're going to look even better. Like the things that Dr. Whipple has planned for me, I'm really excited about. And so I recognize that these breasts are kind of placeholders for now. So I'm super excited to see what the final result looks like.
She's such an artist. I told you
Yeah, she
offline
is.
before we began the interview that I have known Dr. Whipple since, she was in her fellowship. And so to see where she's come and to see her work. And then you had the other dude, Dr. C. What a
I
team you
know
had.
I was so lucky. Really, really
What a
had a great team.
team. Yeah.
Yeah.
Margaret, how about I check in with you for phase two and maybe we'll plan another follow-up video.
I would love that. Yeah, for sure.
So good to see you, my friend. Thank you for doing
So good
this
to see you
today.
too, Terry. I appreciate
Okay.
everything you do. All right. Thanks,
Okay.
Terry.
Take care.